Welcome everyone to today's webinar on the legacy of COVID-19. This is part of our series on health management in action, fostering health system resilience. This is part of the Emma webinar series and it's webinar 10 of 10. So congratulations to all of you who joined us for, I think quite a few have been to all of them and it's been great to have you. And we'll have a new series coming next year, but for this year, we're really excited to have the last webinar, which is a great one in store for you today. So today we're joined by Dr. Paolo Lauriola. He is from ISDE Moderna's president and scientific responsible for the Italian network of Sentinel physicians for the environment. Dr. Lauriola, welcome. Thanks for joining us. How are you today?
Thank you so much. I'm fine, and I'm curious to see if it will be helpful for you.
Great. Thanks for being with us. So we've asked Dr. Paolo Lauriola to join us because we've got a lot of questions around the legacy of COVID. It's been a big topic discussed in the first 9 webinars and also in our series last year. The lessons learned are many, and we reached out to Dr. Lauriola because he has a lot of really interesting direct experiences of what can be learned from the Italian experience, but also further beyond. So we'll hear more from him in just a moment. And just before I hand over to him, I'm spending just a few minutes in this introduction. We'll have about a 20-minute presentation on the legacy of COVID-19, and then we'll have time for Q&A. So that's really your time to have all your questions answered. And so we welcome you to either type in the chat or to also put your hand up and we can take them live. So I also want to tell you a bit more about the series. As a lot of you know, it's been on health management in action. We've been fostering health system resilience and discussing health management topics that are crucial to improve health system preparedness and response. It's co-funded by the European Commission and we thank them for their support. But it's been really led by Emma, and I think a lot of you would know Emma, but for those of you who might not have met us before, we have a vision of excellent health management for a healthy Europe. And one of the ways we achieve our vision is by supporting the spread of knowledge on effective health management. And that's what we're doing today in this webinar, spreading that knowledge. We always work to our values of excellence, quality, inclusiveness, relevance and respect. And I hope you not only experience that today, but every time you engage with us. A little bit more about us is that we're the only membership organization that brings together the full health management ecosystem. It's a big diversity of people. We're a recognized and respected amplifier of best practices in the evolution of health management, and I hope you'll see that today as well. And also what I hope you'll see today is that we provide an environment where evidence, challenge and experience are valued and complex debates on current topics can take place. So we welcome your debate and your questions. Finally, if you're not already an Emma member, please do join us. You can check us out on our website, emma.org/join-us. And our members really help shape all of the work we do, so we'd love to hear from you. So now, without any further delay, I really look forward to handing you over to Dr. Paolo Lauriola. Before I do that, if I could ask people to make sure they mute their microphones, or if one of the Emma team could mute people's microphones who might not realize they've unmuted themselves, so we can have a clear, crisp presentation from Dr. Lauriola. So welcome, Dr. Lauriola. I hand over to you.
Thank you so much, George. And if you like, I can start.
Yes, please, go ahead.
Okay. So, thank you all for giving me the opportunity to talk about some concepts, experiences, and proposals on the role of family doctors in measuring and counteracting global environmental health threats at the local level, also in relation to the dramatic experience of COVID-19 pandemic. This is the map of my presentation. Introduction, Sentinel Physician for the Environment, WHO-1, the Italian experience, criticalities, opportunities, low middle income countries challenge, which is an important issue, and the legacy of COVID-19 and conclusions. Talking about the effect of the environment on health, we usually start from such figures. According to the WHO, World Health Organization, almost 1/4 of global deaths are linked to the environment. Focusing on the health effect of climate change, WHO stated that they will cause 250,000 additional deaths per year as a whole between 2030 and 2050. But please note that all such figures are based only on death. Hence, what is the real burden of the environment on health? In 2009, the World GPs Organization, GPs, General Practitioners, WONCA, assessed that the healthcare systems where the GPs and pediatricians act as gatekeepers, 95% of all patients are initially cared by GPs and pediatricians, and 80% are solved only by them. This brings us to the next point. In the case of climate change, health effect, non-fatal health effects are early indicators of environmental linked condition. If they are not precisely quantified, they could cause a disarrangement of the overall health organization and healthcare systems, with remarkable effects on individual and public health. Please note that the vector-borne diseases are defined as focal diseases, just because local conditions strongly influence them. Global strategies addressing climate change should be implemented locally in these cases, where family doctors' role is crucial. We'll come back to this point later on. More generally, family doctors can effectively close the gap between health and the environment. Owing to their role on individual patients and communities, they can effectively connect global concern with local action. This is an essential declaration from some of the most representative medical organizations dealing with environmental health issues across the world, which confirm what I said before. Nonetheless, family doctors are often unaware of the environmental related health impacts and their potential role to tackle such a global challenge through the local influence on individual and collective attitudes and policies is not considered. These are some activities which family doctors can effectively carry out at the local level. In 1993, Dr. Gardner in the UK published a scientific article on a child leukemia cluster around a nuclear power plant close to Sellafield, proving that the workers' children at that site had a risk twice that as high as expected. Afterwards, local authorities admitted that a military nuclear waste site had one existed in the area, later transformed into a nuclear power plant. After some years, the Sellafield power plant was closed. More recently, in 2016, a massive concern over PFAS in drinking water was raised in the Veneto region in Italy by the Italian Ministry of Health and the WHO Europe, following some early observation and results presented by a hematologist, Dr. Vincenzo Coriano. Subsequently, under the broad and international popular pressure, numerous legislative and technological measures were implemented, and the factory, with discharges of substances, closed. But most epidemiologists agree that the first modern environmental epidemiology study was the natural experiment carried out in London in 1854 by an anesthesiologist named John Snow. He described the mortality rates due to cholera in different neighborhoods and noticed that some figures were higher than others. He also noted that the drinking water supplies were provided by the Southwark and Watford Company in some areas, while in others, supplies come from the Lambeth Company, which 5 years before changed the tapping point upstream in London. Families living in the same premises and supplied by those two different companies showed marked difference in mortality rates. It is essential to underline that all these conclusions were presented 40 years before Koch discovered the agent of cholera, Vibrio cholerae. By the way, Snow elicited some protective conditions, in particular groups such as brewers and Jews. The former because they were used to drinking pasteurized beer, the latter because they used to wash their hands. He first published his theory in an 1849 essay entitled On the Mode of Communication of Cholera, which was fiercely criticized by the Lancet. Anyway, following this observation in 1857, all London drinking water supply companies were obliged to filter Thames water. But, as probably George knows, whoever wishes to investigate medicine properly should proceed thus. In the first place, to consider the season of the year and what effect each of them produces, because they are not at all alike, but differ from themselves regarding their change, and so on. The one who claimed such prophetic sentences was Hippocrates in 400 before Christ, who stated that in medicine, any investigation should take into account the environment where the patient lives. Now, I'd like to draw your attention to the Italian experience, which allowed me to be here today. Everything started with the project funded by the Italian Ministry of Health in 2017, within the preparatory process of the G7 Health Expert Working Group, a project aimed at promoting the definition and implementation of an Italian network of Sentinel physicians for the environment. The name of such an effort is RIMSA, Rete Italiana Medici Sentinella per l'Ambiente, which means, as I said, Italian network of Sentinel physicians for the environment. Its main objectives are epidemiological surveillance and advocacy duties. Other goals are promote in Italy a more effective profile of GPs and pediatricians in the perspective of an environmental health prevention activity, especially in the areas of most significant impacts of climate change. Reaffirm the role of GPs and pediatricians in promoting healthy habits and sustainable lifestyle, both in terms of individual health and within a collective perspective of planetary health. Starting from the definition of Sentinel general practice provided by the EU-funded project Sentinel, led by the Nivel Institute from the Netherlands in 1993, we reviewed the literature dealing with the Sentinel physician networks. Initially, around 7,000 articles matched the research criteria, with an increasing rate of publication over the past 20 years. Most of the studies focused on clinical and organizational issues around the GP's activities. Out of such a huge figure, only a handful of studies, which are shown here, were related to environmental health threats. Only 15 articles, suggesting that only sporadic experiences based on some specific circumstances have been carried out. These findings show that the knowledge and recognition of environmental health issues due to lack of training and or awareness are not a common practice among physicians. Afterwards, some colleagues and I conducted a scoping review to investigate how family doctors connect the global concern due to climate change with local action. Such a review shows that even before the COVID-19 experience, family doctors' investigation concerning their community's environment most frequently deal with vector-borne diseases, as I said before. Many vector-borne diseases are strongly linked to climate change, and they can be adequately addressed by adopting a One Health approach, which is now universally accepted as a useful approach in addressing emergencies like the COVID-19 pandemic. Then we investigated some field experiences of Sentinel practices across the world. In sum, what we have done is summarized along this slide. To strengthen the project, these are some of the activities which have been carried out: website, social media, scientific meeting, and articles. What must be done? First, consolidation, development, and spreading of the training process, creation of a national working group, and start with some pilot experiences. Definition of the work plan to forward relevant health data via electronic medical record packages will be integrated with environmental, occupational, and meteorological ones, which means a lot of work. At present, we are committed to carrying out some pilot experience in different areas and topics. In addition, we are employed in some field trials: dietary counseling versus antidepressant in depression treatment, long COVID and environmental pollution, and a statistical investigation on primary healthcare quality assessment during the COVID-19 pandemic event, based on some specific indicators named ambulatory care sensitive conditions. In this perspective, the criticalities and opportunities we have to face are: the health effects of environmentally driven phenomena are highly complex in terms of how they can be interpreted. To integrate with other organizations, health, environmental, meteorological, and occupational data. As mentioned before, one essential facet and challenge of the general practice network is to couple the epidemiological mission with the influential role of family doctors in their community, either at the individual and collective level. Also in the case of global threats, such as in the case of climate change. What we are working now is to set up and implement a uniform data collection process, defining protocols, procedures, standards, and core accounting for the ethical aspect of data collection, storage, consent, and confidentiality, such as general data protection regulation compliance. We are also aiming to create an international network which should support, develop, and share experiences and proposals in terms of training, data analyzing, and reporting. We are also committed to focusing on low middle-income countries concerned. We are connected with the WHO Department on Public Health in this regard. Along this line in Brussels, a workshop was arranged in June 2018 by ISDE, International Society Doctors for the Environment, in collaboration with HEAL. Some of the main issues which emerged from this workshop will be development and application of guidelines, capacity building must be consistent with the role of Sentinel physician for the environment, sustainable and effective, and transfer of knowledge from a more developed system to the less developed ones. Such an initiative aims to forerunner concerns involving low middle-income countries. But it is also necessary to provide a specific, practical, and motivating training of GPs in these fields to create a professional profile based on epidemiological and advocacy duties. Sound science by providing to GPs support in research and data, clear and effective communication strategies among GPs, their patients, communities, and policymakers. Coming to the legacy of COVID-19, it is essential to start from the beginning, particularly from the origin of SARS-CoV-2. Science, in August 2022, stated that the Wuhan seafood wholesale market in Wuhan was the early epicenter of the COVID-19 pandemic. It is essential to assess the origin of SARS-CoV-2 to prevent future zoonotic outbreaks. And finally, the emergence of SARS-CoV-2 occurred through the wildlife trade. One of the main results of the COVID-19 experience, as I said before, is the rise and the strengthening of the concept of One Health. Please remember that the American Medical Association adopted a resolution on One Medicine, One Health in June 2007. The concept of One Health is the unity of multiple practices that work together locally, nationally, and globally to help achieve optimal health for people, animals, and the environment. When the people, animals, and environment are managed together, they make up the One Health triad. The real essence of such an approach from a practical viewpoint is the interaction and synergy of different disciplines and knowledge, which also means the coaction of professionals, institutions, data, and other resources. Antimicrobial resistance is an example and enormously important issue where the One Health approach must be deployed. Remember, the WHO has declared the antimicrobial resistance, that antimicrobial resistance is one of the top 10 global public health threats facing humanity. Please note that both the contamination sources, humans, animals, food, plants, factories, and the impacts are many and crucial to take into account. Essential are hygienic measures and sanitation, which could avoid the use of antibiotics. Another point which must be pointed out, according to the COVID-19, is the pattern of spread in time and space, which made clear that distinction between local and global has become superficial. The local ecological and human interaction in Wuhan in China have afterwards affected the whole globe, In other words, regional and local political and economic decisions contributed to the global climate crisis. On the other hand, in a globalized economic order, decisions are generally taken far away from where the environmental and social externalities show their negative effects, usually in the low middle income countries. Finally, it is impossible to close such a talk without mentioning the COVID-19 experience, first and foremost on primary health care. The COVID-19 pandemic has emphasized the crucial role of primary health care in diagnosis, screening, and triage, as well as in the short and long-term monitoring of the physical and physiological, psychological condition of those affected. The current emergency has also highlighted the need for GPs to work in coordination with primary and community health care and hospitals. And finally, a multidisciplinary workforce can play a vital role in recognizing and managing environmental, social factors and community health. In conclusion, all work and not play together. And thank you for your attention.
Thank you very much, Paolo. That was absolutely fascinating. Really, you've opened up our thinking to a lot of broad things. And the first thing that comes to my mind is in our role in health management. So what can health managers be doing with this information you've given us? You've talked about the role of GPs. You've also referenced Sentinel physicians, which I want to ask you a bit more about that. And you've given us the broad global context on environmental impacts so clearly. And it leaves me, in one hand, listening as someone who works in healthcare, thinking this is critical and essential and important. And then I wonder, in health management, what can we be doing to engage? For example, do we just respond, or can we take some more affirmative action? So that's, in summary, kind of where my mind's at. I look to the audience to say, if you have any questions, I see a few in the chat box, you're welcome to contribute them. But I'll now clarify my reflections by asking you, Paolo, can you start by telling us what is a Sentinel physician?
Yes, Sentinel physician is a normal general practitioner who should work as he usually did in the past, putting in common what the information he is exposed while doing his normal activities. So nothing more than he usually does. But coming to what you said before, I think that the essence of what I said before is the need to integrate general practitioner with prevention. So mainly here in Italy, unfortunately, I must say, we had some very sad experiences, such as in the case of Lombardy region, where when the epidemic wave arrived in Italy, we general practitioners were not aware, they were not prompt to face such an emergency, and that caused a great terrible effect in terms of public health.
Okay, thank you very much for explaining that. I now turn to the audience again. If you have any questions, I see more are coming in the chat box. One of them is from Faith Nani. She says, how can health managers across continents be supported to manage risks to health from emerging infectious diseases? So how can health managers be supported?
Sorry. Good question, I would say. I think that obviously the main responsibility is policymakers, is over policymakers, and to set up an organization which could facilitate the collaboration among general practitioners and hospitals and prevention departments. So I think that first of all is a matter of policy making, but also it is also important to use the organization at the local regional level to collaborate with them, among them.
Okay, so a key theme there is on collaboration and policy making. I see a question from Zachary. And Zachary, you're in the audience. Did you want to ask that live, or do you want me to?
Sure, I can ask. Hi, Paolo. I'm Zach. I work at M as a policy manager. Thanks for the presentation. And I was just curious, it builds off the idea of the Sentinel physician a little bit, and wondering how can we offer the primary care physicians, GPs, Sentinel physicians, the skills and information that they need, and essentially how can we get them to buy into the idea that they should be educating or have a role in educating the public on these environmental factors?
Yes, for sure. So as I said, the first point is training. So it is essential. By the way, I got my degree many years ago, but I don't think that the situation changed a lot. And the environmental health issues are not introduced are not treated in a satisfying manner during the academic training curriculum. So this is the main point. And I think that first of all, it would be necessary to just to introduce the importance of such issues, but also to create the opportunity to develop such a competence during the activity. So I think that during the day-by-day activities. It is essential to share experiences and promote collaboration. So training and collaboration.
Great, thank you.
So we have several other questions, and we've got one from Evelyn Donahoe. Evelyn, did you want to ask that live? Otherwise, I will read it out. There you are.
Hi, sorry. Yes, so I can just hear an echo behind me.
Yeah, we hear you clearly.
Okay, so I was just wondering, how can healthcare reduce the impact of vector-borne diseases when human populations are encroaching more and more on animal habitats? And then also, there was a recent landmark case in the UK involving the death of a child along a major roadway in London, which ruled that was as a result of air pollution. So how can an organisation like Emma adapt to this emerging issue?
Well, I think that as you mentioned, One Health approach could be a good opportunity to integrate different professionals, disciplines, and organizations. So, as I said, I think that the main and crucial point, very crucial. I've been working for more or less 40 years, and I tried to integrate different organizations, and it is very, 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 very difficult. So I think that according to the legacy and the lessons from COVID-19, what we should do is to integrate different disciplines and institutions. That's it.
Thanks, Evelyn, for your response, Paolo. There's a question from Ali. We've got time for just one last question. And so she says, emerging studies are suggesting a link between air pollution and the increase of stillbirths. What prevention activities can policymakers and decision makers implement to reduce the impact of air pollution on health? Because you did mention before around policymaking and collaborations, what's needed. Is there anything more specific you could tell us about what kind of policies could health managers be encouraging to take place, or decision makers be making to make a difference?
Yes, you said the right words, to make difference. So unfortunately, to make the difference, there is just one point: decarbonization. Decarbonization. I attended the COP27 in Egypt 2 weeks ago, more or less, and this was the core of the activities. But unfortunately, they didn't reach their goals. This goal. So I think that there are many action we could implement, such as mobility organization, such as agriculture. Please note that agriculture is an important source of pollutants which produce secondary particulate matters. Very, very important, and many other issues. But the point is the real action which could be really effective is decarbonization. That is the point.
Okay, and when it comes to decarbonization, if I can push you on that, what I see in so in a lot of hospitals and in healthcare systems,
yes,
in general, we're seeing increasing decisions about procuring products with a lower carbon imprint. We're seeing some health systems introducing policies around smarter purchases and expecting suppliers to meet particular requirements on their carbon imprint. We also hear, like, domestically, people talk about reducing, because of the cost of living crisis, we're already hearing that some health systems, whether it's a hospital or a primary care unit or something else, will be potentially unable to heat their offices properly, or to use enough lighting, and so which could then have an impact on environmental energy consumption. Are these, so forgetting the cost of living crisis, just these changes in how we're using energy within these systems ourselves, are those things that are helpful, or does it need more than that? Like, if we just fixate on what's in our reach, is that the right thing by saying, let's do these things differently, or do we need to see something bigger at scale?
So I think that, by the way, what I said today is just the link between global and local. Yeah, indeed. And first, but what you said, I think that it could be helpful to emphasize this point, that it is important technology I'm very, very confident on what mankind can be do in the future to face such an issue. But we also must take into account that we and I must say that my generation did bad things, I must admit, but we must take into account that the resources, the natural resources are finite. We cannot live thinking that we can do everything we like.
Yeah.
So two things, technology, but also to understand that we are living in a very fragile and limited condition.
Okay, Paolo, we're out of time. I want another few hours with you. I have a lot of questions, but you've given us such a great context about how to improve our thinking, especially in the legacy of COVID, not only being its effect on the healthcare system as a system, but also we have to think about the world and how the system is responding to the world. And unless we change what's happening in the world, we will never be able to bring about the efficiencies that we need to provide the best health to citizens around Europe and the world. So thank you for getting us to focus on both of those things. And also thank you for giving us a context about how One Health can be factored in terms of health management and in healthcare workers in general, because as we see that shift to needing to focus on One Health, I think that's a lot of new learning. As we upskill and reskill the workforce, we need to have them being able to tangibly understand what is our role in a One Health approach to health systems. So you set the scene well, and I'm already thinking for our webinar series for next year that will be a focus. Thinking to next year, please get in your calendars that our conference will be in Rome. So EMA 2023, the topic is Health Management, Sustainable Solutions for Complex Systems, 5 to 7th of June, Rome, Italy. Get that in your calendar, and we look forward to receiving abstracts as well. So if you know anyone who's doing research or has content that's relevant, we would love to get abstracts from them. Abstracts are open for submission now. We always have this 90-second survey. It literally takes me longer to explain it than it will for you to fill it out, but it's just 4 short questions, and your feedback is what shapes these webinars. The reason they're great and interesting is because you've asked us for this content, and if you could keep doing that, that would be amazing. So that's it for today. I really thank you for everyone for being here and for your great questions. I look forward to, I wish you a happy end of year, however you celebrate that. And I look forward to catching everyone next year. Many thanks and take care.
Bye-bye.
Thank you. Goodbye.